Hello, class. I'm now going to do an overview of the sympathetic division, part of the autonomic nervous system. The sympathetic division is considered to be thoracolumbar in origin, and that is because we find it in the spinal cord, originating in the spinal cord. The preganglionic neurons are found there, specifically in the intermediolateral cell column, or IMLCC. Thoracic, lumbar, T1 through L2. So all of the thoracic spinal cord region and just a portion of the lumbar. In this region, we find a lateral gray horn or column. Some textbooks call it column, some textbooks call it horn. The preganglionic sympathetic fibers originate in this lateral gray horn. They extend outward to the peripheral nervous system, and all of these nerve endings would release acetylcholine. It seems so simple at first. Here is the origin of our two-neuron chain, and yet you will see in the very next segment how complicated this division gets. There is a lot to cover here. Now I'm showing you in purple the postganglionic neuronal cell bodies and their fibers. The options of the preganglionic fibers are many, and by that I mean where they can terminate, where they synapse. Let's do this one at a time. A preganglionic fiber can terminate or synapse on the sympathetic trunk ganglia. These are also considered to be paravertebral. The preganglionic fibers release acetylcholine. The postganglionic neuronal cell bodies will have receptors for that acetylcholine, specifically nicotinic acetylcholine receptors. Let's do this first option. The postganglionic sympathetic neuron that comes off of the sympathetic trunk ganglia will release norepinephrine or epinephrine. In the body, norepinephrine is primarily used as a neurotransmitter. Epinephrine is primarily used as a hormone. But please understand, these can, I said primarily, it doesn't mean exclusively. Now, for the sympathetic trunk ganglia option, those postganglionic neurons can terminate, they do terminate on involuntary effectors. This can be smooth muscle, glands, cardiac muscle, or even adipose tissue, which I will address later on. Specifically, if we're considering the thoracic region, head, neck area, if these fibers terminate on smooth muscle, this can be found, smooth muscle can be found lining the air passageways in the lungs. Smooth muscle is part of your iris, specifically the radial fibers, the ones that will cause pupillary dilation. Cardiac muscle. We can even think of smooth muscle fibers in blood vessels serving the head and neck. So on smooth muscle, we can find for head and neck specifically and lungs, we can find two different receptors, and I'll address this again later. In the iris specifically, we would find alpha-1 receptors on those involuntary effectors. You will remember from lecture that when it comes to our catecholamines, they have very specific receptors, adrenergic receptors that they target. Dopamine, which was discussed in class, targets alpha-1 and beta-1. Norepinephrine can target alpha-1, alpha-2, and beta-1. Epinephrine targets alpha-1, alpha-2, beta-1, beta-2, beta-3. So that should be a 3. Let me fix that. There we go. So epinephrine communicates to all adrenergic receptors. So again, if alpha-1 receptors are targeted on the smooth muscle found in the eye, specifically the iris, we would see pupillary dilation. This postganglionic fiber can release norepinephrine or epinephrine and target those alpha-1 receptors. Those neurotransmitters can also target beta-2 receptors that are found on the smooth muscle involuntary effectors lining air passageways. Your beta-2 receptor, if you remember from lecture, is your muscle relaxant. It causes smooth muscle to relax. So in the air passageways, it will cause bronchial dilation. Alpha-1 receptors can also be found on glands. If we're going to the head or neck, an example would be the salivary glands. If you are running for your life, now is not the time to be producing copious amounts of saliva juices. Instead, they get scant and thick. You might think about how nervous you were to give your speech in front of the class and how your mouth felt like, quote, cotton mouth. In the heart, we have beta-1 adrenergic receptors. I like to think of how many hearts do you have? One. What does it do for you? Beat. So we have one heart that beats for us. That helps me remember beta-1. If epinephrine or norepinephrine targets these receptors, we would see an increase in heart rate and force of contraction. That means positive chronotropy and positive inotropy. These sympathetic paravertebral ganglia can also go to the skin to reach dermal effectors. Now, this is an exception. Here we see a postganglionic neuron that is considered to be sympathetic, but releases acetylcholine as if it were parasympathetic in origin. And in fact, in embryology, that is how it originated. But as you developed, those special neurons were dominated by higher levels in the brain and are now considered to be sympathetic. So your dermal effectors, the special case scenario, have muscarinic acetylcholine receptors, much like what we saw in the parasympathetic video I posted. We find smooth muscle in the dermis, lining blood vessels, but also smooth muscle controls your erector pili. When you are running for your life or you're frightened, we think of goosebumps. So that's the smooth muscle of the erector pili. In blood vessels going to your skin, when you're running for your life, you don't really need good blood flow to those effectors, to your skin. This is the reason why someone who's in shock in a sympathetic moment feels cold and clammy to the touch. We also get increased sweat from sweat glands in the dermis. Again, cold, clammy to the touch. We think, just to go back a little bit, we think of the sympathetic division as our 4 F's: fight, flight, freeze, and sex. And by that I mean ejaculation. And I'll talk about that in class. A lot of times, students think that the sympathetic division is, quote, on only during those 4 F's, when in fact, your sympathetic division is on all the time. So is your parasympathetic division. It's really a question of which one has more control. And I'd like you to remember that as I go through the remainder of this video. Another option is for the preganglionic fiber to connect to or synapse to a collateral ganglion, also known as a prevertebral ganglion. We can get even more specific and label these as the celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. These ganglia have fibers that would also release norepinephrine and epinephrine on smooth muscle, glands, and adipose tissue. These are found inferior of the abdomen on the blood vessels that they are named for: celiac trunk, superior mesenteric artery, inferior mesenteric artery. Again, they can target smooth muscle by release of norepinephrine and epinephrine, glands, or adipose tissue. On smooth muscle, we can find alpha-1 or beta-2 receptors. Smooth muscle lining the gut utilizes primarily alpha-1 receptors, and we would see decreased gut motility and decreased blood flow to blood vessels serving the gut. When you're running for your life, that is not the time to release digestive enzymes, have more blood flow to your gut. That's considered unnecessary at that point. And you certainly don't want to turn to your predator and say, "Excuse me, time out. Can you give me a break so I can go big potty?" But there are also blood vessels in the gut, in the abdomen, I should say, going to your lower limbs, where you would want more blood flow. If you're running for your life, that would be considered necessary. So again, your beta-2 receptors are considered to be a relaxant. Blood vessels in that case would vasodilate. What about glands? Glands in your gut, digestive glands. Again, alpha-1 receptors predominate. That is not a time when you're running for your life to release more digestive enzymes, so we would see a decrease in the release of those. Running for your life, you might need to use alternative fuels. Adipose tissue has the beta-3 receptor. And when those are stimulated by epinephrine, we would have an increase in release of fatty acids to be used as fuel. Now here's another, what seems to be an exception to our 2-neuron chain rule. The adrenal medulla, which is found in the adrenal glands. It's the deepest layer, and the adrenal glands are found superior to the kidneys. This is my sad rendition of the kidneys. These postganglionic neurons, in all examples, would have nicotinic acetylcholine receptors to respond to the acetylcholine released by the preganglionic fibers. Going back to the adrenal medulla, we would see it release epinephrine as a hormone because it's being dumped into the bloodstream. This is part of the reason why the sympathetic division can respond in what physiologists think of as en masse. Altogether, we get a huge shifting in control to the sympathetic division when that epinephrine is released into our bloodstream. Students oftentimes think that the adrenal medulla, being a gland, is considered to be the involuntary effector, and that this case would break the two neuron rule, when in fact, the chromaffin cells that are found in the adrenal medulla are actually modified postganglionic neurons, and I expect my class to know it as such. The involuntary effectors in the body are still the involuntary effectors that I've addressed earlier in this video. We also remember from class, as I mentioned earlier, that blood vessels can frequently have different adrenergic receptors. In one of my slides, I show you that beta-2 receptors are fewer in quantity on the smooth muscle that is found in blood vessels, specifically the tunica media. Alpha-1 receptors are more abundant. But we have to address affinity, greediness, the likelihood of binding. Beta 2 receptors are fewer, true, but they have greater affinity. And that means at certain levels of epinephrine release, beta 2 receptors will populate first. And that means we'll see vasodilation. If, however, epinephrine levels go up, we will see more alpha 1 receptors binding to that epinephrine. That means because they are greater in number, they will outmatch the beta 2. Let me say that again. At greater levels of epinephrine release, all of these receptors will be bound. But then numbers win. If all are bound, we will see vasoconstriction, because that is what alpha 1 receptors will lead to in the smooth muscle lining blood vessels. I'll remind you at this point to remember your second messenger system that would be involved in these involuntary effectors when the sympathetic division gains control. As I said in class, although these adrenergic receptors do technically use different second messenger systems, we are using the beta 1 receptor as our prototype, and therefore you should be focusing on your cyclic AMP messenger system.